Hi, everyone. Thanks so much for joining us today. We're going to give 1 more minute for folks to join, and then we'll get started. All right. Hello, everyone. It is 3:02, so we're going to go ahead and get started while some folks are still trickling in. Hi, everyone. Thanks so much for joining us today for our 2022 Open Enrollment webinar. My name is Dori Malazanov. I'm a senior manager on the Health Systems Integration team at NASTAD. And I'm also joined today by some of my colleagues at JSI and the ACTA Center, Molly Tasso and Lisa Liu. And we'll have time for a Q&A at the end of the webinar, so please feel free to submit questions at any time through the GoToWebinar questions feature, and we'll address them later. The webinar is going to be recorded, and we'll circulate a recording and a slide deck along with some other resources within a few days. So with that, let's get started. So today we are going to talk about open enrollment updates and marketplace re-enrollment processes, how to help clients maintain access to coverage all year round, Medicaid eligibility during and after COVID-19, some policy updates, strategies for preparing for open enrollment, and then my colleagues at JSI will talk about some training resources and best practices for enrollment. First, open enrollment period updates. First, some exciting news. Open enrollment has been extended. All healthcare.gov states and most state-based marketplaces will have open enrollment from November 1st through January 15th. This means clients will have a whole extra month to enroll in plans for 2022. However, clients should still enroll by December 15th when possible, so they can get coverage on January 1st. Clients who missed the December 15th deadline can still get 2022 coverage, and they can switch plans after the 15th if they change their mind about the plan that they initially chose. But if their enrollment is completed after December 15th, their coverage will not start until February 1st. The exceptions here are Rhode Island and Massachusetts. Clients in these states have until December 23rd to enroll in coverage with a January 1st start date. There are 3 new state-based marketplaces in 2022. Kentucky, Maine, and New Mexico will no longer be using healthcare.gov. Any changes to 2021 coverage will still be done through healthcare.gov, but clients will need to make accounts on the new state websites for open enrollment. In New Mexico, clients can make their new accounts as early as tomorrow, October 8th. I know Maine's marketplace website is not open for account creation until November 1st. And I'm not sure about Kentucky, but in New Mexico, at the very least, clients can make accounts as early as tomorrow. And later on, my JSI colleagues will talk about why it's a best practice for clients to create or update their accounts ahead of open enrollment. So this means that 18 states will have state-based marketplaces going into 2022. They are not required to extend their deadlines, however. But most states are following the healthcare.gov deadline of January 15th. Only Colorado so far has made this a permanent change. And for those that are not following the January 15th deadline, Maryland, Idaho, and Connecticut will keep the December 15th deadline from last year and the couple years before. Massachusetts is closing on January 23rd. New Jersey, New York, and Rhode Island are closing on January 31st, at least this year. And California and Washington, D.C. have permanently extended open enrollment through January 31st. A few states are still allowing clients to enroll in coverage or change plans for 2021. This is a no questions asked special enrollment period. You don't need to have a qualifying life event. This is especially important for clients who are approved for unemployment benefits for even 1 week anytime in 2021, since they're eligible for maximum financial assistance. If they receive unemployment in the future, they'll probably be eligible for a special enrollment period. But if they received employment many months ago, they can still get these enhanced benefits in these states that still have COVID special enrollment periods open. But remember that the unemployment-based enhanced benefits are only available this year. They do not this does not carry over into 2022. So now I want to dust off a topic that we haven't addressed during this webinar in a few years: marketplace re-enrollment processes. This applies to clients who already have active marketplace coverage. There are 2 ways to re-enroll. Active re-enrollment is when a client returns to their application during open enrollment, but no later than December 15th, and actively selects the same or different plan. Clients who don't do this will be automatically re-enrolled on December 16th in most states. State-based marketplaces also might have different processes or timelines for that. But clients who don't do an active re-enrollment by the 15th will then be automatically re-enrolled on the 16th. 79% of enrollments in the last open enrollment period were re-enrollments, meaning folks who already had marketplace coverage. Of those, just over half, 58%, were active re-enrollments, people who actively selected a plan for 2021. But you can see that 42% took no action and allowed the marketplace to enroll them automatically. So while not a majority, it is still definitely a popular option. So let's talk more about automatic re-enrollment, and then I'll explain why active re-enrollment is the recommended option for clients. Most clients will be eligible for automatic re-enrollment with some exceptions. Federal law prohibits sale of plans to people that the insurance company knows have Medicare. So if the insurance company learns that someone has Medicare, coverage is going to terminate for everybody on the application, all the household members on the application. We're going to talk, we aren't going to really talk today about transitioning from Medicare to the marketplace, but I've added a link in our resources slide that I'll circulate after this presentation that talks about when and how clients should make this transition. Another exception I didn't list here applies to Kentucky, Maine, and New Mexico. Since these states are migrating to new state-based marketplaces, clients will need to claim their new accounts before they can enroll, and automatic re-enrollment won't be an option. So on December 16th, the marketplace will automatically process enrollments for clients who did not actively choose a plan by the 15th. In most cases, clients will stay in the same plan. But if that plan doesn't exist anymore, the marketplace has a hierarchy system for choosing a new plan for you. The new plan will usually have similar coverage and costs, but it could be a different plan or with a different insurance company. The marketplace may also automatically renew or discontinue financial assistance based on the client's most recent available income data. This is referred to as auto redetermination of advanced premium tax credits and cost sharing reductions, or APTCs and CSRs. Some clients won't be eligible for automatic redetermination of their financial assistance, even if they're automatically re-enrolled. This includes clients who did not check the box on their application last year, authorizing the marketplace to access their income data for this purpose. Clients also won't have their APTCs and CSRs automatically redetermined if their 2020 income was over 500% of federal poverty level, or FPL, according to available data. If their income is now lower than it was in 2020, they can still go into their application and update their income at any time to claim APTCs and CSRs. They just may not be able to switch plans anymore after open enrollment ends. The next group are sometimes referred to as passive re-enrollments. These are folks who automatically re-enrolled for the last 2 years, didn't make any updates to their applications during that time, and don't have any available income data. So maybe they didn't file a tax return, for example. It's typically the reason. And typically, clients who fail to file and reconcile their tax credits are also ineligible for auto redetermination. In fact, they're usually ineligible for tax credits altogether. But since so many people weren't required to file and reconcile for 2020 due to COVID, this has been suspended. Clients will therefore not lose their APTCs and CSRs if they didn't reconcile for 2020, and their eligibility will be automatically redetermined as long as they don't fall into any of these other categories. So automatic re-enrollment is a good policy because it keeps people insured even if they don't take action during open enrollment. But it's important to encourage clients to choose active re-enrollment for a few reasons. Open enrollment is the time when clients have the most freedom to choose coverage that's best for them. They may not have another opportunity during the year to switch to a plan that they prefer. Active re-enrollment also ensures the most accurate APTCs and CSRs based on the client's most up-to-date income information. Otherwise, redetermination will happen based on whatever is the most recent information available to the marketplace, and it might not reflect the client's actual current financial situation. Clients can update their income at any time, but they likely won't have another opportunity to choose any plan that they want after open enrollment. The marketplace also will not automatically choose a silver plan for you if you don't already have one, even if you're eligible for CSRs. Remember that cost sharing reductions are only available for silver plans. If you're currently enrolled in a gold plan, for example, the marketplace isn't going to move you to a silver plan so you can take advantage of those savings. You need to actively do that yourself. And you probably won't have another chance after open enrollment to switch to silver, which I'll touch on a little bit more later. There could be new plans or insurance companies available this year that weren't available before. So active re-enrollment gives clients a chance to explore those new options. If you switch plans after the auto enrollment happens, that is on or after December 16th, you will probably have to wait until February for your coverage to start. So that's why it's best to start assessing options early and actively choose a plan by December 15th. And again, if the client or someone else in the household is eligible for Medicare, the entire household will be terminated rather than re-enrolled. But this can be avoided if clients actively update their applications. If this does happen, though, other family members can get an SEP to re-enroll, but again, it could delay their coverage start date. Right now, maintaining accurate financial assistance means realizing even more savings on premiums. Under the American Rescue Plan Act, signed into law in March of this year, tax credits will be higher for almost everyone. This includes people who would otherwise be over income. The tax credit income cap is lifted in 2022. While some very high income folks may still be eligible for nothing, the vast majority of ADAP clients will be eligible for at least something. And everyone who receives tax credits will be eligible for more money than they typically would be. There will even be $0 silver plans available to lower income clients who receive tax credits. In other words, folks in this income range are eligible for maximal financial assistance. I'm saying that phrase with emphasis because I'd like you to bookmark it in your mind, the maximal financial assistance for lower income clients, because I'm going to come back to this. Just remember that right now, clients in this income range of 100 to 150% of the poverty level are eligible for maximal financial assistance. Okay. Addressing churn and maintaining access. Let's talk a little bit about special enrollment periods, some refreshers, and an update. Special enrollment periods, or SEPs, allow clients to newly enroll or switch plans outside of the annual open enrollment period, but only if they experience a qualifying life event. These are things like losing coverage, moving, getting married, etc. SEPs have limits. Clients usually only have a 60-day window to apply for the SEP and choose a plan. If you're switching plans, you generally have to stay in the same metal level. This is one of many reasons why we recommend really assessing all options carefully and actively choosing a plan during open enrollment. The choices that you make at the beginning of the year affect what options you'll have if your circumstances change later. Another one that I left off here is that most SEPs are also only available if you already have or recently had some other form of coverage. In other words, most of them do not apply to folks who are uninsured or who've been uninsured for more than a couple of months. And it's advisable for clients to choose a plan by the 15th of the month, of course, again, so that coverage starts as soon as possible without disruptions. Although some SEPs allow you to enroll after the 15th and still start on the next, the first of the next month, but most do not. So there are a lot of SEPs. I'm including a really great resource in my resources slide that I'll circulate if you want to read more about them. But here are some that are especially critical right now, given how many clients are facing unstable employment during COVID. So the first two are about changes in your coverage. First is if you lose coverage, for example, because you leave your job. Second is if your COBRA costs increase because your employer stops paying. But when I circulate these slides, I'll add, additionally, not only if your employer stops paying, but if you're, actually, I'm going to stop there because I'm not 100% sure. I'll follow up on that. If your COBRA costs change because your employer stops paying, when I circulate these slides, I'm going to add another one with some more important points about COBRA. I just took it out for the sake of time right now because it's something I've addressed on multiple other webinars, but a little more information about COBRA will be coming your way. You may be eligible for an SEP if you can't afford the insurance available to you through your job because it's too expensive compared to your income. So maybe you get a new job and the insurance they offer is too expensive, or maybe you already have coverage through work and then it becomes too expensive because your employer stops paying for as much of it, or your family income decreases. In these scenarios, you can get an SEP to enroll in a plan with tax credits. Having insurance through your job is not a bar to tax credit eligibility if the coverage is too expensive. There are some other financial changes that can make you eligible for an SEP if your income drops, if you're approved for unemployment benefits, or if you're in a state without Medicaid expansion and you move out of the Medicaid gap because your income increases. You can also qualify for an SEP if you move to another state or to another region within your state that has different plans. And if you missed an SEP deadline because of a reason related to COVID-19, you can qualify for another SEP. Again, these are just some examples, and I'm going to include a great resource with a lot of information about these and plenty more, but these are just some of the ones that we see a lot during the pandemic in particular. So there's going to be a new SEP in 2022, and we're very excited about it. This SEP is unlike the others because it's available year-round, and it doesn't require a qualifying life event. You qualify for it based only on your income. Clients with income below 150% of the federal poverty level can enroll any time of year and can switch plans once per month. But it has some limits. So first, it's available year-round, but it's not available all the time, which I know sounds confusing. So remember earlier when I was saying that the American Rescue Plan Act temporarily gives certain clients access to maximal financial assistance? And I asked you to bookmark that in your mind. Well, this is why. This SEP is only available during periods when folks in this income bracket qualify for maximal financial assistance. A wonkier way of saying that is that it's available when Congress sets what's called the premium contribution for this income range at 0%. The American Rescue Plan Act does this through the end of 2022. So this SEP will be available for all of next year and possibly longer if Congress makes this premium contribution level permanent. I know that's a little bit hard to understand. I had a lot of trouble figuring out how to articulate it, so if folks have questions about it, please feel free to drop them in the chat. There are some other limits too. The new SEP is not available off marketplace. State-based marketplaces do not have to implement it. Clients who use this SEP are still bound to the same metal level. And clients still have to meet all requirements for tax credits to use this SEP. Their income must be at least 100% of the federal poverty level unless they qualify below that threshold because of their immigration status. They can't be eligible for Medicaid or be in the Medicaid gap, and they can't have affordable coverage through their job. Limitations aside, it's estimated that as many as 1.3 million uninsured people will be able to gain coverage due to this SEP. It also gives low-income clients who lose Medicaid extra time to enroll instead of only having 60 days. And it presents opportunities to increase enrollment among hard-to-reach communities. Sorry, I need to get some water. So let's distill all of this into some ways that ADAPs can support clients in maintaining consistent access to coverage and care during the pandemic. First, it's important to screen clients who lose employer coverage or lose eligibility for other types of insurance. As always, it's important to caution clients against non-ACA compliant products like short-term plans that are deceptively marketed as good, affordable coverage. They're neither. States can't terminate Medicaid enrollments during the COVID public health emergency, except if a client moves out of state or voluntarily ends their coverage. So if any of your clients have involuntarily lost their Medicaid since March 18, 2020, they should ask to have it reinstated as soon as possible. Clients should also still keep up with their redetermination paperwork, even if they're eligible for a more generous benefits package. The only way to switch is through redetermination. And as clients churn between coverage types during these uncertain times and take advantage of the American Rescue Plan Act's enhanced marketplace assistance, ADAP financial forecasting may need to account for changes in full pay program enrollment and shifts in rebate generation. So don't forget to take advantage of NASDAQ's rebate forecasting tool available through OnTap. As you may know, there have been a lot of changes to Medicaid eligibility and processes during COVID, especially what I just mentioned about Medicaid being prohibited from disenrolling anyone. So what happens when the emergency ends? Medicaid agencies must follow a timeline for resuming normal operations. They have 3 months after the end of the public health emergency to clear out the backlogs of pending applications caused by COVID. They have 4 months after the emergency ends to resume timely processing of applications. And then most of the other things that they've delayed have to be done in 12 months after the emergency ends. So for example, post-enrollment verification of information provided on applications, renewals, and so forth. I'm mostly sharing this for your awareness. There isn't really much here for Ryan White and ADAP programs to prepare for, since we don't know when the public health emergency will end. But ADAPs can reach out to their Medicaid agency to find out the plan for resuming pre-COVID Medicaid procedures in their state, since every Medicaid agency needs to have a plan like this. They aren't required to publish it or anything online, but they do need to have a plan. And I also will say that this timeline CMS has already changed it a couple of times. It's very possible it will change again. This should give you kind of a sense of the types of timelines that we're looking at after the PHE ends to resume normal Medicaid operations. Again, clients can't be disenrolled during the public health emergency. This is true even if the client was found ineligible based on redetermination paperwork submitted during the pandemic, or if they didn't respond to a request for information from Medicaid. Both of these things would normally lead to disenrollment, but not during the public health emergency. States will eventually be able to resume disenrollment, but they will need to do one more redetermination after the public health emergency ends. So they can't terminate someone because they submitted documentation during the public health emergency that shows they're ineligible. They need to do another redetermination. States can request documentation from clients when doing redeterminations, and they can disenroll folks who don't respond pursuant to normal Medicaid rules, but the state first has to check its own data sources to see if the information is available elsewhere. This is always the case. It is not a special rule for COVID. And now for some policy updates. There are some new marketplace regulations that were recently finalized, mostly reversing some of the policies from the last few years that created barriers to obtaining and maintaining coverage. Enrollment in marketplace plans through private non-marketplace websites is no longer allowed. All marketplace enrollment must be completed through a marketplace website, healthcare.gov, or a state-based website. Plans were previously required to send 2 bills to folks whose plans included abortion coverage. The one of those bills was for most of your premium, and then the other one was just for the really small portion of your premium that's attributable to abortion coverage. Even though it's a really small amount, it was still problematic because needing to pay 2 bills is confusing, and there was a risk that people would lose coverage because they don't know they need to make 2 payments. So that requirement is no longer in place. Section 1332 waivers, which allow states flexibility to implement innovative models in their insurance markets, are now going to be subject to stricter standards than they have been in the last few years. Open enrollment is extended, as we discussed. And navigators will be required to provide certain types of post-enrollment assistance that were optional for the last few years, things like filing appeals, tax referrals, and improving health insurance literacy, among others. Medicaid work requirements are being rescinded across the country. CMS has withdrawn its approval of work requirements in 9 states. 5 states have withdrawn their work requirements themselves. Within these 2 groups, there were some that were invalidated by federal court also, but by now they've all been withdrawn by CMS or withdrawn by the state. 2 states have postponed implementation indefinitely, but technically still have approval. And 6 states still have pending applications. Some of them have been pending for several years though, so I'm not thinking it's likely that they will ever be approved, but they are technically still pending. I last did this scan about 5 weeks ago, so my apologies if this slide does not reflect a recent change in your state. And finally, I'll close out this portion of the webinar with some additional considerations as you head into open enrollment. So first, a brief refresher of ADAP insurance purchasing cost effectiveness rules and NASDAQ's plan assessment tool. Remember, the overall policy is that Ryan White grantees may assist clients with insurance premiums and cost sharing if 2 criteria are met. The plan includes at least 1 drug in each class of core ARVs from the HHS clinical guidelines, and paying for health insurance is cost effective in the aggregate relative to paying full cost for premiums. So this piece about aggregate costs is important to remember. It means that the average cost per insured client must be lower than the average cost per full pay client. So clients with lower insurance costs can offset clients with more expensive coverage. When determining cost effectiveness, make sure to consider the net costs, including discounts and rebates. Don't necessarily rule out more expensive plans right away. Look at the net costs, including rebates, because the rebates may be enough to offset those higher cost plans. Remember that if you include discounts in your drug cost estimate, you also need to include rebates in your insurance cost estimate. And NASDAQ's 2022 cost effectiveness tool, which many of you are already familiar with, is going to be released closer to open enrollment because the plan data is not available yet. If you have questions about the tool or you need help implementing it, please reach out to me via email. And the 2021 tool is still available in the meantime. Of course, the ongoing COVID-19 pandemic creates some unique challenges during open enrollment and throughout the year. We've seen ADAPs implement policies to streamline enrollment and recertification, including extending deadlines, relaxing documentation requirements, conducting enrollment and recert by phone or electronically, and accepting verbal client consents. Client meetings and assessments can also be modified to allow for social distancing, for example, by talking to clients on the phone rather than in person, waiving signature requirements, and using telehealth when feasible. We encourage programs to continue strengthening these policies and processes to ensure a smooth and safe open enrollment. States are also encouraged to continue assessing cost effectiveness of plans and rebate generation impact on program funding, which NASDAQ is here to support you in these efforts. And we encourage you all to continue working closely with clients to assess eligibility for different coverage programs, particularly as clients lose coverage or face other financial challenges during the pandemic, and also to continue monitoring state and federal policies that affect coverage and access during the pandemic, which we are also monitoring these things, and we're here to support and answer questions and share information. Here's a list of resources that may be helpful to you before, during, and after open enrollment. Don't worry about saving this. I'm going to circulate these slides in the next couple days, and you can access these links. My email address is also at the top there. I'm sure most of you have it from registering for the webinar, but there it is. And now I'm going to wrap up. That's the end of my portion of the presentation, and I'm going to be available for questions later. Use the question box to submit questions. And with that, I'm going to hand it off to JSI to talk about some resources and best practices.
Great, thanks so much, Dory. Hi, everyone. My name is Molly Tassler. I'm with JSI and the ADAP Center. I hope many of you are familiar with us. If not, though, I'm just going to quickly introduce sort of what we do, and then what I'm going to be doing is talking to you today about our HRSA-funded TA Center, and also sharing with you the resources and tools that we have to help Ryan White organizations prepare and to conduct enrollment services throughout Open Enrollment, and our hope is that you then sort of take our information and take our resources and disseminate it to the Ryan White subrecipients and other funded organizations that you all work with in your states. So as you can see here, the ADAP Center helps build the capacity of the Ryan White community to navigate the changing healthcare landscape and help people with HIV access and use their health coverage to ultimately improve health outcomes. So specifically, we support Ryan White recipients and subrecipients to engage, enroll, and retain clients in Medicare, Medicaid, and individual health coverage options, such as the Marketplace. Build organizational health insurance literacy, thereby improving clients' capacity to use health systems, and communicate with clients about how they might stay enrolled in this health coverage. So on the next slide, you'll see our audiences, program staff, Ryan White program staff, including case managers. We also referred to sometimes as benefits or enrollment specialists, Ryan White organizations, leaders and managers, Ryan White clients, and also navigators and other in-person assisters. Really anyone that helps enroll a person, a Ryan White client, into health coverage. So to kick off the next piece, Dory, on the next slide, I'm gonna present to you 3 online training modules that we have available, as well as some other Marketplace enrollment resources. So on the next slide, you'll see we have this great resource. It's called the Health Insurance Literacy Training Module, and it helps strengthen a person's understanding of the basics of health insurance and support Ryan White clients to get enrolled, use their health coverage, and stay covered. This module here is self-paced, it's online, and it's a really great place to start for staff who might be new to supporting Ryan White clients, or who might find it helpful to have a sort of refresher of these basics. I'll also say I'm going to be adding links to these resources as well to the email that Dory will be sending out, so there's no need to, we're not going to chat anything out. You will get links to all these in the coming days. On the next slide, you'll see that we also have another training module that's aimed at helping organizations get prepared for open enrollment, which, as Joy mentioned, starts on November 1st. And so this training gives a really month-by-month overview of activities that an organization should be prioritizing between now and November. So really, I know we only have about 3.5 weeks left, but there are a number of things that organizations can be doing to make sure that they're ready to start meeting with clients and enrolling folks on November 1st. And then on the next slide, we have this training module that, so Dory had mentioned, had talked about APTCs, premium tax credits, and cost share reductions. This online module helps explain all of that. And it also details the process of how individuals apply for these types of financial assistance, and then also how the financial assistance that might be available through the Ryan White program, including ADAP, how that sort of plays into all of that. And then finally, also explains how a person can help a client who does receive APTCs file and reconcile their taxes. We know, as Dory mentioned, that's important because it impacts eligibility for future financial assistance. And then on the next slide, you'll see for all of the resources that we have and tools that are based on Marketplace coverage, we have a dedicated web page on our website that you can go to, and everything will be organized by topic area, such as eligibility, engaging clients in conversations about coverage, enrollment, and then using and staying covered. So as we gear up for the November 1st open enrollment start date, we really know it's important to ensure that Ryan White subrecipient organizations and anyone conducting enrollments are prepared to enroll clients. Dory, you can go 2 slides. Next slide. Perfect. So it's important that case managers and everyone sort of understands the basic eligibility criteria for Marketplace coverage. So to be eligible to enroll in health coverage through the Marketplace, you must live in the United States. You must be a United States citizen or national, or be lawfully present. And also you cannot be currently incarcerated. When applying for Marketplace coverage, individuals are automatically screened for Medicaid or CHIP eligibility. And then if they're found to be eligible for another health coverage option, they'll be sort of rerouted to that particular application instead of enrollment through the Marketplace. Generally, enrollments are done online by an individual, but people can also get assistance. So in this case that we're talking today, that might be from case managers, benefits specialists, enrollment staff, certified application counselors, and also certified navigators. Next slide. Organizations should also, as I talked about earlier, taking steps to prepare for open enrollment. So we sort of have coined these actions to be, we call them account tune-ups. And so an account tune-up it's a pre-enrollment appointment that can take place in person or remotely, and it should be done in advance of the November 1st open enrollment date. There are 4 main steps to an account tune-up, and again, all of this is taking place before November 1st. So when a case manager might meet with a client, they're going to want to check paperwork, accounts, and payments, make sure that the sort of previous year's health insurance enrollment is sort of wrapped up. Review finances to determine eligibility for financial assistance and estimate income for 2022, so next year. Confirm enrollment in Ryan White in the ADAP program. Make sure that their recert is up to date. Maybe if it's coming due soon, maybe just go ahead, and if you can do that again or early, that would be very helpful. And then also just have a conversation with the client, preparing them for open enrollment, and then also schedule that enrollment appointment. Next slide. When you're scheduling that open enrollment appointment and when you're moving into an enrollment appointment, it's important that everyone's sort of on the same page about the goals of that meeting. So it's important to clarify that the goal of the appointment is to screen for eligibility, and that there is no guarantee of enrollment. That is just helpful to get everyone on the same page. And it's also very helpful if clients can come prepared with their marketplace login and their household information. And case managers or program staff should also, of course, be sure to provide the client with all the necessary meeting information or enrollment appointment information ahead of time. So we've heard that because, of course, we're focused on safety right now and keeping everyone healthy. A lot of appointments are happening online through Zoom or whatever sort of online platform. So just making sure that the client understands how to access that and make sure they understand and have all the sort of tech things that they need in place to be able to have that meeting. And then on the next slide, you'll see some really important key messages that a client should be receiving, and really that organizations as a whole should be promoting throughout open enrollment. So these include just generally the importance of health coverage and a reminder that the Ryan White program is not health insurance. Yes, it can and does continue to support and provide HIV services, including medication and ambulatory care, but that anything outside of that, such as a emergency room visit, that is not covered. And so it's really important to have comprehensive health coverage. Also explaining that there is financial assistance available is really reassuring for folks. And as Dory mentioned earlier, making sure that we remember that a cheaper health plan is not always better. And that is a great message to communicate as well. On the next slide, I'm just going to share some resources that we have quickly. So to help disseminate these messages that I just reviewed, the ADAP Center has developed a number of consumer tools, a couple of them here on this slide. The one on the left is a consumer, it's a Q&A, and it provides answers to commonly asked questions such as, why do I need health insurance? How will I pay for it? How, will I have to get a new doctor? Some really great information in there. And the second resource is called Making the Most of Your Coverage, and it helps folks make them, it goes over everything about sort of once you get health insurance, then how do you use it? So how to contact an insurer, the basics of healthcare costs like premium and out-of-pocket expenses, and also where to go for care and how to prepare for a medical visit. And then we also have a health insurance poster series. So on the next slide, you'll see these are available in both English and Spanish, and there's 4 sort of buckets: enrollment renewals, staying covered, and then staying covered, and it's the impact of staying covered on a person's viral load. So these posters generally are intended to be printed and hung in waiting rooms or exam rooms or really any other shared space. And they're really useful in helping sort of spark conversation between a client and a medical provider or a Ryan White, a case manager. On the next slide, you'll see just a couple examples of these posters. On the left is one focused on enrollment. The one on the right is promoting a renewal. And then on the next slide are a couple snapshots of the new posters we have that are intended to spark conversations around treatment as prevention and the role of health coverage in supporting people with HIV to reach or maintain viral suppression. So these are new. Again, I will be putting all of these links and everything together for Dory to send out in an email. So you will be getting those in your inbox soon. And then lastly, I'm just going to talk with you all quickly about just some best practices for establishing enrollment partnerships. So as Dory has mentioned too, and really emphasized, we feel really strongly about a person receiving one-on-one enrollment assistance, especially if this is a person's first time enrolling into health coverage. And so we, if feasible, we really strongly recommend organizations to have a person on staff who is knowledgeable and trained around health coverage and around enrolling folks into health coverage. And then also the Ryan White program, of course. And in states that use healthcare.gov, the marketplace, there's a free training for certified application counselors, also referred to as a CAC. This training is available and can help really sort of train up staff in terms of understanding the best ways to move forward with enrollment with clients. And we really strongly encourage people to check that out. And then on the next slide, you'll see for some, one more, sorry, Dory. There we go. Thank you. For some recipient organizations, we also recognize it just might not be feasible or realistic to have enrollment specialists on staff, and it just may make more sense for them to establish a strong relationship with an external enrollment partner and then refer clients out for enrollment services. So these partners may include navigators, CACs, insurance agents, or brokers, or any other enrollment specialists. The sort of thing that we highlight with this, though, is just to remember that although those enrollment specialists may be the health coverage experts, the staff of Ryan White organizations are the experts on Ryan White. And so they should really be taking the time to train external partners on the unique health coverage needs of people with HIV, and also making sure to provide information around if and how the Ryan White program in your state or jurisdiction is intersecting with and supporting the health coverage for Ryan White clients. So for example, if your state ADAP or even a local Part A program might be playing into, sometimes organizations or states will assess the health plans available in a marketplace in a state and then make recommendations for Ryan White clients. If that is taking place, that information needs to be passed along to any person doing enrollments, whether it is sort of in-house or if that is taking place externally with a partnership organization. And then on the next slide, just a couple really, again, quick resources that help train external enrollment partners. So, excuse me, the first is a one-page fact sheet sort of in the back, if you will, about medication and care needs, enrollment concerns, and how the Ryan White program may be able to provide financial assistance for health coverage. And that's really, this resource is really for folks who are pretty new to both the Ryan White program and enrolling folks with HIV. And then the second resource is a little video there. It's a short animated video that provides essential tips to folks who might be new, again, to supporting people with HIV. It's pretty fun, so I will send that around and hope you all check it out. So with that, that is the information I have today. I hope this has been helpful. Please don't hesitate to send us an email if you have any specific questions, if they're on the slide. But again, I'll be following up with resources, and I will hand it back to Dory.
Thank you so much, Molly. Sorry for my little, sometimes, Zoom live can be a little bit tricky to keep up with the slides, so my apologies there. But that was fantastic and so informative. Thank you so much. Like Molly said, we will be sending around resources and links for everyone, along with a recording of this webinar and the slide deck. So now we have some time for questions. We've gotten some good questions already, which I'm going to go through now. Feel free to keep on dropping them in, and we'll get to them. The first question is for Molly. Are the JSI training modules free?
Yes, yes, yes. Everything I've presented here today, everything on our website is, yes, free, and it's on the Target HIV website. Again, we are a HRSA funded cooperative agreement. So yes, we are, everything we have is free and available to you. And yeah, look for the links in your email from Dory.
Great, thank you. Right, so now we have some other questions here. I'm going to start to, I'll read them aloud and I will provide responses. If I don't get to yours, I will follow up via email, I promise. So we have a question here about the low income SEP. If your state has expanded Medicaid and a client has income at 138% or below the federal poverty level, meaning they qualify for Medicaid expansion, can they also qualify for the special SEP since their income is within the right range? No, they cannot. Remember, I said one of the limitations on the SEP is that you have to be otherwise eligible for tax credits, and having Medicaid, it means that you are not eligible for tax credits. So this would be more helpful for folks who are, just above Medicaid levels. If your state expanded Medicaid, obviously if your state did not expand Medicaid, then folks over 100, between 100 and 150 would definitely be able to benefit. And also remember that certain lower income immigrants are eligible for marketplace tax credits from 0 to 100% of the federal poverty level because they're not eligible for Medicaid due to their immigration status. And even though it doesn't seem like it makes a lot of sense, that rule is actually in place regardless of whether your state has Medicaid expansion. So again, this SEP helpful for folks above the Medicaid cutoff, folks in Medicaid non-expansion states between 100 and 150% of poverty level, and lower income immigrants who qualify for tax credits because they're not eligible for Medicaid due to their immigration status. Can brokers no longer do direct enrollment? Yes, that is correct. All marketplace enrollment must happen through the marketplace website. There is no longer allowed for brokers to, the way that this direct enrollment used to work is that you would, start on the marketplace website and then you would kind of at some point be like transferred over to a different website to finish your enrollment. Perhaps also you would start on another website too. I don't actually remember that, but essentially it allowed enrollments not to be completed through the marketplace, and that's not allowed anymore. Let's see. Even though the SEP with for low-income clients under 150% of the poverty level allows them to switch plans monthly, wouldn't they want to avoid this due to deductibles and cost-sharing accumulations? Yes, this could be a concern. I think the idea is that folks who are in this income range would probably get silver plans because they would have such generous cost-sharing reductions. I know that sometimes in the ADAP context, it's not quite that straightforward. But the policy goal here, I think the policy I think relies on this assumption that folks would probably end up getting silver plans because they're the most advantageous for folks in this income bracket. I also don't think that the intent is for folks to actually switch plans every month. I think the idea really is just, to give low-income clients just maximum flexibility to choose a plan and have a plan that works for them. I don't think the expectation is that people will necessarily be switching plans every month, but it's just maximum flexibility. And in fact, folks who belong to Native tribes also have, and this has always been the case, have a similarly structured like monthly SEP. How is employer insurance being too expensive calculated? So this, the way that it's calculated is the coverage has to be more than, I think it was 9.78% of income, of household income. but there is a caveat there called the family glitch that when and it's very bad policy. It's at the top of, it's on every advocate's short list, I think, of things to fix. The family glitch basically means that 9.78% is calculated based only on the cost of coverage for the employee. So if I'm the employee and I want to, get coverage for my spouse through my job, and the coverage for me is really affordable, but my employer doesn't really contribute that much to spouse coverage, and so my spouse's coverage is incredibly expensive. Unfortunately, that would not enable me to get, me or my spouse for that matter, to get tax credits. We all are considered to have an offer of affordable coverage because the employer coverage is less than 9.78% of my income. And the slides, when I send them around, they have the exact number, but I think I actually got it right. Okay. I wanted to go back and find it, but I guess there. Job-based coverage premium for employee only costs more than 9.78% of income. Let's see. Just double checking that our American Rescue Plan Act changes concerning lower premiums for persons with incomes below 400% of the federal poverty level are being applied to all insurance plans. It's I don't know, all insurance plans means all marketplace insurance plans that are eligible for tax credits. I think if I remember correctly, catastrophic plans cannot use tax credits, but all the other bronze, the metal levels can. So yes, those changes apply to all plans that you can get tax credits for, which are all metal level plans on the marketplace. They don't apply to off marketplace plans because you can never get tax credits for those plans. Oops. All back to the contact page. Okay, let's see, we have a few more minutes. Great questions, everyone. Is the list of ACA plans out by state yet? And if so, where can you find it for 2022? So healthcare.gov does not have that data yet for states that use that platform. I feel like they keep coming out later and later every year. We expect it, any day now. For state-based marketplaces, they might have different timelines. I am less aware of when the data becomes available for state-based marketplaces, but I think most states do not yet have this information available. Should be available any day now. Open enrollment is coming soon, and as far as where to look for it, well, I mean, first, typically, once the plan information is available, your marketplace website will have a compare plans option available. So that's like a consumer friendly way of accessing that. Alternatively, you can look at plan information with your state Department of Insurance because it all has to be filed there. For clients enrolled in a state's ADAP, where ADAP is paying for a client's premium, is that client eligible for tax credits? Yes. The fact that clients are getting ADAP funded insurance assistance does not change their eligibility for tax credits. If they're eligible for tax credits, that does not change just because ADAP is paying for their premiums. And in fact, taking the tax credits is, obviously represents a savings for the program as well. So typically states will encourage clients to seek those tax credits and apply for them. All right, I think I do have a good question here about brokers, which I'm racking my brain to remember my talking points about this. But some states allow brokers to sell policies, which most of the time do not meet participant health needs. What advice would you give in such cases? Actually, I'll see if my JSI colleagues have anything to share about working with brokers and yeah, anything for my JSI colleagues before I take a stab.
Yeah, so I also invite my colleague Liesl to pop in if she wants to as well, but we really strongly encourage anyone working with a broker to make sure that that person understands that an individual needs their medications covered, and also really sort of lab work, and also making sure that their either primary care or their infectious disease doc is in network. And so it's tough because I know some states do employ, because talking about external enrollment partnerships, again, you know, it might just be the reality that that's the route that an organization or state needs to go to make sure that their Ryan White clients are enrolled. So if that is taking place, I think we would recommend really strongly using the resources that I introduced earlier, and making sure that anyone working with a Ryan White client understands that medication access is very important, again, as is either their primary care or their infectious disease doc being in network. Liesl, do you have anything else that I am sort of missing in terms of Ryan White programs and clients working with agents and brokers?
Only, I think it just builds on what you shared earlier, but to, you know, a lot of programs that we've spoken with who work with brokers do training with them sort of in the lead up to open enrollment, so they're aware of the key needs of people living with HIV. So that's where kind of our 8 things to consider for people living with HIV tool that Molly shared is really helpful in terms of always serving as a reminder of the key points to consider when enrolling a client.
Great, thank you. I think, yeah, otherwise, I think just like, you know, kind of being aware of I think like brokers can make really good partners for programs, also have, they definitely have made really great partners for programs in a number of states, but, you know, also have like competing interests financially. So making sure they know how to work with the clients with this particular client demographic, as Molly said, is critical.
Dorian, I would just say one more thing, sorry. Almost guaranteeing that they are not going to enroll a client into like a short-term limited duration plan or something like that. Making sure that they understand it needs to be like a fully a comprehensive health insurance plan.
Yes, definitely. That's a great point. Thank you. Okay, it looks like we are out of questions. There's one tricky one that I'm going to follow up with over email because our resident 340B expert is not with us today. So I think we have no more questions, so we can close out now. We'll be following up soon with resources and recording and slides and so on. And of course, feel free to reach out to me or Molly, or folks at the ADAP Center with any additional questions that you have. And please enjoy the rest of your Thursday.